Hello, everyone, and welcome. My name is Anjum Sultana, and I am a strategic advisor with Kimbo Care, and today I'm your host. I'm really glad to be in conversation with two incredible panelists, both Franck Tiambo, a co-founder of Kimbo Care, as well as Dr. Fatimah Jackson-Best, who has been leading Pathways to Care, a Black mental health initiative in Canada. So for today, we're going to have a conversation. We're also going to make it interactive. We'll have polls, and we're hoping at the end of this conversation, we'll figure out together how can community participation help to lead and influence an equitable post-COVID recovery, the topic of the time and in this historic time that we're in. So I want to take this opportunity to introduce my panelists and get started right into the conversation. But one of the things we wanted to do is to figure out if this conversation is actually changing your perspective on this very question. So we're going to launch the poll right now. So my colleague will be launching it. You'll see it in the video right below us. And the question will read, how does the pandemic impact health equity efforts? So you have four options, and what we'll do is we'll do this poll right now. We'll see in the middle of the conversation, how did the audience decide on this question? And at the end, we'll ask the same question. So the options are, things will get worse, nothing will change, some things will change, but it won't sustain, and finally, it will accelerate the reduction of health disparities. So you should be able to see the poll right below, and we're really excited to hear what you have to say. So while people are voting in the poll, I'm going to go to our first question and have our panelists introduce themselves a bit more. So the first question I have is asking our panelists to share a bit about who they are and their journey and the organization that they're part of. So I'm going to first ask Franck to share. So Franck, I'm really glad to be in this conversation with you. You've been doing pivotal work with Kimbo Care over the last year and a bit. Could you share a bit about yourself and Kimbo Care? You know, the mission, the vision, and what made you start this enterprise?
Yeah, Anjum, thank you very much for me and to invite me on this call. I think that community participation is really a hot topic and also one of our core of how we work at Kimbo Care. But before doing that, let me take a step back. I grew up in one of an African country, and I left to study in Switzerland. And so same thing for my sister Muriel, who is my co-founder. And so over the years, we have been supporting our family back home, in particular for healthcare, right? And as we supporting over the years, we were really frustrated knowing too little about how well our loved ones were taken care of, right? And as we share about our experiences, we also realized that our situation was not isolated. Many people around the world were in our situation and facing the same challenges. With all the new technology, blockchain, AI, you name it, we thought with Muriel that we need to do something. So we created KimboCare. So KimboCare is a digital healthcare platform which allows anyone to prepay medical services to a financially underserved person with having the highest level of transparency around the effectiveness of care, at all of that at a reasonable cost. So we have been around for a couple of months. We have a lot of different stories to share for now, but we can single out maybe just one story about this grandma that she is living in the countryside in one of Africa country. She has a long medical history, and her legs were in jeopardy, to say the least. And her daughter just paid on our website the health credits services, and just in 24 hours we have been able to locate the grandma. We brought pack her to one of our partner clinics in Douala, and we brought the community also together to get some financial help. And now we are really, really happy because she's recovering and she sent us a very, very touching message. And I think that this is the fuel, this is the energy that gives us the passion to continue our mission at Kimbo Care.
That's fantastic, Frank. And I can imagine it was such a proud moment for you, for the organization. And it seems like you're enabling people to meet their needs through technology. And it's really humbling to kind of see and witness your journey with Kimbo Care, the work that you're doing. Next, I'm going to ask Dr. Fatimah Jackson-Best to share a bit about herself, as well as the work that she's been leading in Canada around Black mental health. So it's an initiative called Pathways to Care, and it's groundbreaking. I've heard about it, I've read about it, and it's really inspiring to see this work. And I was wondering, Dr. Jackson-Best, if you could share a bit about the initiative, the history of it, and how did it get started, and how did you get involved in this work?
Well, thank you, first of all, for the question and for the invitation to be a part of this panel today. So Pathways to Care, I've been involved with it since 2018, September, when it, just after it was initiated. So Pathways to Care is unique in that it is the project that is a systems level change project focused on improving access to mental health and addiction services for Black children, youth, and their families in Ontario. And so what makes it really unique is that this project is not one that's born out of nowhere. Black communities in Ontario, in Canada, in Toronto, all over have been making really loud calls for action around mental health and also highlighting the barriers and things that inhibit them from getting help. And so the reason that one of the things that makes Pathways to Care so unique is that it focuses primarily on Black children and youth and demystifying the mental health system there, but it also includes their families because we recognize that without family, whether that is biological family or chosen family, without their engagement and involvement and buy-in, a lot of the times the gains made for mental health and mental illness can be lost. And where it comes from, or where this project really emerged from, was ongoing calls for mental health care and specific healthcare provision and attention to mental health for Black people in Canada. As I said, the calls have been made for a very long time, since I was, an undergraduate student, and obviously even before then. And the calls have only gotten louder as we see, the world changing and mental illness becoming more complex and more people, being upfront about whatever mental health challenge or illness they may be facing. So, it comes out of a bunch of different places, but my interest in mental health really comes from my academic and professional interest in mental health. I've always been interested in the mental health of Black communities. And so when I was given the opportunity to lead this project, I really jumped at it because it's novel in many ways, and it's also has had a lot of unforeseeable perks, like me being able to mentor, young researchers and, lead really engaging community-based participatory research here in Ontario. So, it's like a dream come true, really, even though it's obviously born out of a very dire situation that's pressing our communities.
Yeah, and I think what's great about it is you were mentioning it didn't come out of nowhere. It was grounded in what communities were calling for, and throughout the process, communities were involved every step of the way. And I think that really speaks to that sustainability of the initiative as well, because so many people have their skin in the game, if you will. That's incredible.
Thank you.
Yeah, and what I want to do now is go back to the poll and see, from both of the panelists so far, we're getting a sense that community participation is so critical, is so necessary, and leads to the results that we want to see in healthcare and other sectors. So if we can pull out the poll results, we can kind of see that, how people are feeling before we started this conversation, and then we'll see again at the end how that changes. So as we wait for that to get pulled up. When it comes up, I'll chat a bit about it. Next, so now we have a sense of both of the initiatives that you're leading and a bit about what made you come to the work. We are living in a historic time. COVID-19, when we started 2020, in fact, when I'm thinking about February, March, I feel like that was like 10 years ago, right? So much of life has happened. And I'm wondering, each of you are working towards health equity. What does this moment mean for that? So Dr. Jackson-Best, I'm going to go to you first. You're based in Canada. You're doing work in many parts of the Caribbean and North America in general. A lot of these disparities were issues before the crisis. And in many ways, it's just deepened, right? It's really either exposed it or made it worse. And we're seeing, in particular, many different communities have been impacted: Black and Indigenous communities, racialized communities, women, people with disabilities. So I guess, given this context, what should we do? How should we make the most effective use of this moment where people are realizing, hey, this is a concern? Where should we put our investments, our resources? So I want to kind of send it to you and see, what should we be doing as a movement, as a community here?
Yeah, it's such a big question. And actually what's interesting is that this year, I also teach at a university here in Ontario, and I teach a class on infectious diseases and contagion and risk. So all we do is talk about COVID-19. And one thing that I've really been pressing into my students, and also pressing into just community members, family, friends, acquaintances, etc., is that this is a really huge moment for health equities. And of course, what COVID-19 has done is shown a light on the existing inequities that we live in, right? And these are inequities that, again, communities have been pointing out for an extremely long time: issues of poverty, discrimination and racism, lack of access to good care, good food, etc., and it's only been magnified. So I think that in this situation, what it means for health equity is that we have to see that health inequities are always interrelated, and they're connected. And so that means that our approach to solving or addressing inequities also has to be interconnected and engaged and collaborative, right? So while we are, putting out fires that are related directly to COVID-19, we have to also be attuned to the fires that have been raging before, right? So people who are living in extreme poverty, people who have insecure housing, people who have lack of access to good, nutritious food. These are all factors that underlie health inequities and exacerbate them. They're exacerbating COVID-19 and the pandemic, and the response to the pandemic can never be as good as it can be if we are not addressing those inequities as well. So, now is the time for increased collaboration across all of our sectors to address all of the underlying issues that impact health inequities and to solve those. Because even if we get a handle over COVID-19, or when we get a handle over COVID-19, there's still going to be poverty, there's still going to be gender imbalance, there's still going to be LGBT, phobias, homophobia, transphobia that negatively impact people's wellness and their health. So we have to be committed to doing the long, hard work. Those inequities are, as I said, they have been existing for an extremely long time, longer than this pandemic has been around, and they're going to continue afterwards. So we need to refocus our energies towards ensuring that we are not just putting Band-Aids on the COVID situation, and look towards solving the underlying issues. And we have so many bright, incredibly talented people who have given policy papers, recommendations, information, TED Talks about how we can start to do some of this work. Paul Farmer, he's an anthropologist. Paul Taylor with Food Share has been talking about food inequalities and inequities, right? And under COVID-19, that has become, magnified. He was advancing this idea of converting golf spaces or golf course spaces to be used for food, right? These are long-term solutions that we can start to engage in now that will last beyond the pandemic and start to address some of the other underlying issues that fuel and push inequities further.
Yeah, that's such a great example. When I read that from Paul Taylor, that was such an innovative way, and that's exactly how we need to be thinking, right? Like completely disrupting, should we use land for example, right? When there is this dire need for food, and food insecurity is a big issue. Maybe as a quick follow-up, and maybe, if you want to expand a bit, what is giving you hope at this time? Like, what is, you mentioned the Paul Taylor example. Is there anything else that is giving you hope?
Absolutely. Well, people like Paul Taylor definitely give me hope. People who have been engaging in community-based responses, like virtually, give me a lot of hope. Rebecca Price, as a yoga instructor, she has been doing some amazing work just around healing and meditation and wellness for Black communities and communities generally during COVID. Those kinds of things give me hope because it really reaffirms to me that, no one's okay. We're all working on this together and struggling towards becoming okay, or, having okay moments throughout the day. But glimmers of hope are everywhere. And I find that, I'm always encouraged by seeing young people talking about, the specific ways that this pandemic has been affecting them, and young people also coming out and talking about the ways that racism has been overlapping with the pandemic and, fighting against it. The students in Calgary, I believe, who walked out of class who, were not having their teacher, they weren't responding, or they weren't having the fact that their teacher was using the N-word in class, walking out of school and demanding an apology and demanding change. That gives me hope. The students at University of Ottawa who are pushing back against their administrations, who are also, engaging in anti-Black behaviors and legitimizing it through academic freedom, that gives me hope. Paul Taylor, as I said, gives me hope. My family gives me hope. My friends gives me hope. Everything gives me hope because I am by nature a hopeful person. And, I cannot allow my mind to, ruminate in the negative parts. So I find hope absolutely everywhere, but definitely people making, courageous steps and very courageous calls. That's what gives me hope, and it fuels me.
Yeah, no, I'm definitely there with you. I'm someone who is by nature an optimist, and I'm hoping our optimistic energy can rub off on our audience, because I just saw the poll results. So folks were saying, when we asked the question, how will this pandemic impact health equity? 60% said things will get worse. And 40% said some things will change. So for me, my hope is through this conversation, our optimistic energy can rub off on our audience members. But thank you so much for sharing. Frank, I'm going to come over to you next to ask, you're doing incredible work with Kimbo Care. You're working in places where healthcare access is perhaps fragile. And in many ways, perhaps this COVID-19 crisis has made that worse. I'm just wondering, can you share a bit more about what you've been seeing in this moment for the work that you've been doing, how COVID has impacted it? And I'll ask you a follow-up question afterwards.
Yeah, sure, Anjum. Definitely, Anjum. We are living very difficult moments. It's about 10 months, and in many places in the world, it feels like we are still learning a ton about the pandemic and how to work around it. So looking at Africa, it has had an even more unpredictable evolution, right? Somewhat less morbid than predicted for mixed reasons, young population age, lack of testing, experience in pandemic management, etc. Who really knows? But having said that, with KimboCare, we took a number of steps early on to cope with the COVID-19 outbreak in the continent, especially in West Africa, where we are present. So to name a few, number one, we leverage the experience from China and from Central Europe very early on. We work closely together with our partner clinics to put in place sanitary measures, secure essential social distancing products, such as masks, such as gel and sanitizer, stuff like that. The number two that we have done was in regard to access. We were pioneers in offering proprietary online COVID self-assessment to our community member before visiting our partner clinics in case of advanced or acute symptoms, for instance. And maybe the third example was about education, how to educate our communities. We publish on LinkedIn, on Medium, some thought leadership articles to help shape the conversation around stronger participation of the individuals, and also, really more importantly, for the participant of the private sector to design and to deliver COVID-related solutions and even beyond.
Thanks so much for sharing. And, in many ways, what this crisis has shown us is what happens in one part of the world can affect all of us in, all the different parts of the world. Each of us are in 3 different countries right now. And, we're kind of seeing how innovations or disparities in one part of the world can influence other parts. So I share this because given this context, what are some of the things you think we should invest in to ensure predictability, stability, resilience in important services like healthcare?
That's a great question, Anjum. I think that has, for the path forward, I would like to say we need to focus on 2 main things to realize a sustainable delivery of healthcare. Number one, understand that we are creating solutions for the patient and other people impacted, and engage them in the process. We need to engage them in the process. That is really critical. And to that extent, we need to equip our communities with the right tool and also the right mindset to deal with local cultures and work efficiently at the local level first. I can give you an example which is really interesting on my side, is a community of young women in Abidjan working to educate around prenatal care, family planning, but also helping the financially underserved members to go to a clinic to get birth and delivery services, and even actively supporting the family during the first years. And this is a wonderful example which shows the power of bringing people together. The number 2 is leverage technology. The new technologies take us places where we have never been before, allowing us to build the trust at scale, to deliver better quality care and enable convenience to use the use of services. So the good news is that there are numbers of digital healthcare organizations like Kimbo Care, but many others. They are getting out there and try to embrace the mission to save millions of patients across Africa with, let's say, all this technology. I think that will be a game changer, to use the second pillar.
That's great. And I want to follow on this thread of community participation. So I'm going to kind of take us through the next question or the next round. Frank, I'm going to come back to you first, just because you were kind of sharing a bit about the different ways that you're doing community participation. Can you elaborate more? Like, what are the models? Like, how does one actually start that process? Because it's one thing to say we need to engage people, but what are some of the steps that you take to make that happen? Especially because you're working in so many different parts of the country that countries that you're working in, for example.
Sure, Andrew. I don't know if you can hear me very well because I have some issue with the mic. Is that okay? Okay, no problem. So I think that community participation is really crucial, right? We have seen an unprecedented global collaboration during those last months. NGOs, government, civil society, private sector, communities, we all understood the hard way that we all have to play a part, right? And we are better off not sitting and waiting for help. And that mindset has played out in several ways at KimboCare. For instance, going back to something I mentioned at the beginning of the conversation, we launched Kimbo Care earlier this year, right around when the pandemic hit, back in January, February. Just like in many countries around the world, patients did not want to go or even be seen going to the hospital because they were scared that other people would say that they had COVID and try to gossip about it. So some other just wanted to also to stay at home, but in some cases wanted to know whether they have, let's say, enough symptoms to go to the hospital, right? So basically, that's the reason why we almost decided overnight to put a self-assessment of COVID in our website, and that was, as I mentioned, that was done pretty overnight and made accessible the test on our community member before they can go to our partner clinics, so that will help to to get a more better access to healthcare for those population. So this is an example of how our engagement with patients in our community inform the way we serve them. We engage very similarly with our customer, because we also have focus group with our customer, designing innovation sprints. We call our customer Kimbos, but we also have this focus group with our partner clinics to understand their pain and challenges, and to find a way that we can shape some solution with them. And I think that is pretty it. And I think that the result that we got those last months, we are very encouraged to move forward.
That's great, Frank. And I heard two things that community participation was really crucial for addressing when it came to COVID, like that example you shared around stigma, right? People were fearful of actually accessing care because then, would they get negative, responses from community members or, people who have seen them go to the hospital. And then also you were talking a bit about the severity, right? People were feeling like almost like they won't go in the early stages until it got until it was bad enough to then seek help. And when I think about stigma and severity, I wonder also, Dr. Jackson-Best, if this applies to mental health, for example, right? There is a stigma that has started to reduce over the last number of years, but there's still a stigma, right, when it comes to accessing services for mental health. And then similarly, severity, right? People might not go until it's crisis, and then perhaps then it's too late. So with this as like a connection point that I see between both of your work, both of your initiatives and work, Dr. Jackson-Best, I was wondering, tell us about community participation in Pathways to Care. And, what are some of the lessons learned that you see could be applied to other settings, other parts of Canada, other countries as well? So first, over to you.
Well, community participation is like extremely central to our work with Pathways to Care. We have 3 different community-based governing committees. We have a youth advisory committee, we have an expert reference committee, and we have a community advisory committee, right? And all of those groups throughout, from the very beginning, we've been meeting with them, letting them know our plans, letting them know our focus, letting them know our progress, and it anchors us, right? I think that if you're you cannot work in community if you're not anchored in community, right? And I think that a lot of the times people people forget that you need to have community involvement and community buy-in to have any kind of measurable success. And that's a framework or a model that I think can go anywhere in the world. Like whether I'm working in the Caribbean, I feel it's even more kind of pronounced, the need for community and the interconnection of communities, especially because the islands that I typically work in, like Barbados, are quite small, right? Like there's populations of less than 300,000. So people know each other. People know when you come to the island, right? People know who your families are. And people know when people are not well. And so that is one way that we can start to engage and counter stigma, which, as you said, rightfully can be extremely harmful to people's overall health and can have deleterious effects on people's overall mental health and physical health. But we need to be engaged in community in order to properly address any of the issues that exist in communities and to find the solutions. And that's really, I think, where I want to hinge my next point on. Our communities are a wealth of solutions. We possess so much expertise, so much knowledge, so much information that can positively impact our communities, right? But the reality is that communities' insights are oftentimes not as valued as stakeholders' interests or government interests. When in actuality they should be even more held up even more important than those stakeholder interests, because they are the primary beneficiaries of our interventions, right? So we need to completely shift and change the ways that we view communities, the way that we engage with communities, and at what points we have to be engaging with our communities from the very beginning in order to have their, as I said, their buy-in and their approval and their insights and their expertise. But as I said, I have a mentor, or he was my mentor during my master's. His name is Paul McKenzie, and a couple of years ago, he said, with regard to mental health, there's no Calvary coming. There's no one coming to save us. We have to do all the work. But the good news is that all of our expertise, everything that we need is actually in our communities. And that, as I said, that goes for across Canada, across Ontario, across the Caribbean, et cetera. So our approach to, involving and engaging our communities at Pathways to Care, it just reflects, what should be happening, how we should be engaging with people in order to do this work. So yeah, it's like I said, it's a model that is cross-cultural, it's cross-regional, it's cross-geographical, but it's probably the most important ingredient when it comes to doing that kind of community-based work.
Yeah, I think that's so powerful what you just said about all of the assets, right? This asset-based approach, right? Really seeing engagement with community members as not a nice to have, but essential, as fundamental for us to reach the goals that we need. I know sometimes it's hard to talk about recovery when we're kind of dealing with a crisis, right? We're in the middle of this, especially when it comes to mental health and physical health. But I'm wondering from your perspective, Dr. Jackson-Best, what role do you see for community participation in these recovery conversations, and perhaps even these reimagining conversations when it comes to healthcare or, broadly?
So again, I see community as being has to be central to recovery efforts and discussions about recovery efforts. There is no way that we can know what communities need in terms of recovery without engaging with them and taking up their recommendations earnestly, right? The reality is that a lot of communities are used to people coming and consulting with them and then having absolutely nothing done afterwards. So I think that if we're going to engage with communities, we need to come from a perspective, an actions-based point of view, right? This is what we want to know from the community, and this is how we're going to engage in it or facilitate it or push it moving forward, right? But we have to center communities in any COVID recovery response, especially as we know that mental health has been negatively impacted. We all know this. I think anyone can testify to this. We've all seen people's mental health, and reports of people's mental health declining because of COVID, the lack of physical engagement, social distancing, the changes that we've all had to go through in Canada, the winter that we're going to have to go through, et cetera. Well, we can't know the intricacies of those issues without centering community, right? So any COVID response, I think, that does not center communities, and particularly marginalized and racialized communities, LGBT people, Black people, Indigenous people, people of color, people who live with disabilities, et cetera. Any plan that does not center and engage these communities for recovery, there will be no recovery. There cannot be a recovery without that kind of engagement.
That's great. I actually have on this piece, because I know, Frank, you wrote a piece for Kimbo Care for the LinkedIn a couple of weeks ago or a couple of months ago about the future of Africa, for example. I wanted to kind of ask you this recovery conversation as well. But before I do that, I do want to encourage people in the audience to ask us questions. We're going to go into the Q&A very shortly. So if you have any questions from our incredible speakers, please do put it in the chat so we can make sure we answer them because we have, people working in all parts of the world on this event here today. So definitely, please leverage your expertise. So Frank, we talked about community participation. We talked about your work with Kimbo Care. You've been also leading conversations around the future, right? What does the future of healthcare look like in Africa? Can you tell us a bit about where you see, community participation going with your work? And just, in 2021, what are some of the things you'd like to see when it comes to this?
Yeah, sure, Anjum. I think that the work that we are doing at Kimbo Care is really, really important. We have seen a lot of different communities. You can see the different culture from community to community. And we found a way that we can, at the same time, understand one community and then find the benefits on the way that they are doing to bring that benefits also to other communities, right? So we have been very lucky because we are doing our pilot in two different countries. One is Ivory Coast in West Africa, and the other is Cameroon. We spot a lot of differences in terms of culture, in terms of community participation, but we still have one things in common. Finally, they really want to take care of the patient. So committee are really coming together to take care of the patient, and they are finding ways to make that happen. So even with the very difficult time with the COVID-19, we have seen in our communities people taking the time to call and to discuss with people isolated, right? I can tell one story about also the help that we have given to a student association where here in France, where students were in lockdown, so um, they can't go outside, they can have a job for living. So it was very difficult for them, even for mental health. And the community organized themselves to call these isolated people. So what we can say for now is that we collect a lot of different information about the culture, about how the communities are operating at the local level. And now we think that the technology that we are bringing to the market, which is bringing trust and transparency, will very help to go forward in that sense. And I think that is something that we can really explore in the coming months.
That's great. And, kudos to both of you. You're living through history 10 months into this crisis. It's becoming like the new normal, right? But then you're always wondering, are things going to change again? So being able to be flexible and pivoting where needed. And it seems like community participation is helpful for that, right? Because you can hear in real time if something's not working, but you can't hear that if you don't actually have those relationships already. So it's really incredible to hear about how you're doing that. Many of you were doing that before this crisis, but I think this crisis is showing us that is going to be necessary to move forward. I want to see, from our audience, have they changed their minds on community participation? And its role in post-COVID recovery, making it more inclusive. We have a poll, the same poll, just to kind of gauge have people changed in their perspective. So again, for folks who are in the audience, please do fill out the poll. How does the pandemic impact health equity efforts? Do you think things will get worse? Do you think nothing will change? Some things will change, or equity will accelerate? So while our audience is, thinking about this question, I want to actually just ask each of you, what is your main key takeaway? What is one thing you want people leaving here today to think about? So first, I'll go to Dr. Jackson-Best. What is your key takeaway from this conversation?
My key takeaway is for this conversation is absolutely, again, the centering of communities for this pandemic response. I think that we, as you said, we're living in a historical moment, and most of us, as a result of just trying to cope and manage, we're just taking things day by day. I know that sometimes that's how I have to just look at life, hour by hour, even, forget about day by day. And, when we're taking things in such measured steps, it can be really difficult to think about what does recovery look like. And even for myself, when you're living in this moment for so long, it's it feels like there's no end in sight. But I would say again and again, like one thing that has been a huge help facilitator during the pandemic has been community. One thing that will continue to be an incredible facilitator will be community. And for recovery and for moving forward, it's going to continue to be community. And so I think that we all, like the main takeaway is definitely for myself and for, I hope anyone listening, is that we need to reevaluate and reestablish the ways that we engage in community and engage with our communities, right? We have to be honest about our placement in our communities, and also in terms, be honest about how we can and will affect change, because there's just absolutely no way that we can even think about, the future without thinking about a new kind of future. And so we know that like the way that things were going is not sustainable, could not manage, and that's why things have come to a grinding halt because of the unsustainability of everything. But one thing that can be sustainable and that can sustain us is one another. And so I think that we just need to continuously re-engage and reaffirm and reimagine the ways that we are, positioning ourselves in community and working within our communities.
That's so important. And, really hearing very clearly, nothing about us without us, right? If you're going to be working for community, you have to be working with community, right? So I want to, pass it over to Frank, and actually a question has come in. So maybe in your key takeaway, if you want to kind of answer this as well. Essentially the question from Maget Sacco is, what are solutions for low income populations? And how can microinsurance participate in this fight? And then, as you're answering that, if there's a key takeaway you want the audience to leave.
Yes, thanks a lot for the question, Margaret. I think that is also a new thing that we are seeing in Africa. It started in East Africa, but now it's coming to West Africa as well. The micro insurance is really a solution that can help low-income population to get a kind of coverage in terms of healthcare. But it's a really early stage. So the first thing is to make sure that those population can have a decent coverage in terms of health services. But the other stuff will be once those people will get sick, they need to have also the infrastructure, the quality medicine, all the ecosystem to receive that care. So I think that is already a good solution to have microinsurance, but we need also to try to work on, let's say, workaround solution where a lot of people are paying the healthcare expenses out of pocket, and we can find innovative way to help them pay that medical services. For instance, at KimboCare, with this transparency that we are bringing, we can leverage the out-of-pocket money from the diaspora, for instance, or for some philanthropists. So we need to find also alternative models to give to those low-income population the gift of health. So I think that my main key takeaway, I mentioned that a couple of times already, is trust, right? We are living in community where the trust was eroded over time. We need to rebuild that trust to give to all those people the confidence and the peace of mind to help low-income person. So I think that also with technology right now, we can achieve that. I'm really positive about that. We started 10 months ago. Now we are serving already a lot of different patients, and we see that is working. So that's my key takeaway. I want to finish by thank you all. I would like to thank you, Anjum. You are doing a very good job at Kimbo Care. You are very, very international about women access to healthcare. And we know all that in Africa, women are at the center. So healthier women means better access to care. So we're really happy to work with you, and we try to find innovative solution to get that access to those women. And also thank you to Dr. Fatimah. It was a real pleasure to listen about mental health, all these strategy, all these actions, because I like the term actions. I think that this is a comment which is most of the time overlooked, even in the Black communities, because people, yes, they think that if you have mental health issue, that means that you can't live in society, or you can't be happy with what you are. But I think that is more complex than that, right? That's the reason why the job that we are doing is really critical to help those people to move forward and to be heard, I would say. And finally, I would thank you all the people online. Yeah, it was a great pleasure to be there today. And thank you also my co-founder, Muriel. She was not able to be there today, but she also doing a good job helping KimboCare to get the next level.
Thank you, Frank. So kind, such a wonderful note to end on. Yeah, it's been such a pleasure being part of this panel and learning from all of you. I think we learned a lot about how community participation is going to be what is the next iteration of healthcare in all its forms. Like, it will need to be the foundation. Frank, you talked a lot about trust. Dr. Jackson-Best, you talked about accountability. And I think for those things to happen, community needs to be at the center of those conversations, and not done in an ad hoc or tokenistic way, but being done in an authentic way. I do want to just acknowledge a comment in the audience about, it can't all be on community. It has to be bringing all the different stakeholders together. But I think what's been happening for so long is community has been been talked about, but not included in the decision making. So what I want to do before we go into the group fee, so we do want to, invite people to take almost like a selfie, but with all of us together, just to kind of, create a memory out of this moment. I do want to say, both to Frank and Dr. Jackson-Best, your remarks helped to change the audience. Before, people were perhaps not as optimistic about what this pandemic could do for health equity, but we're seeing actually, 50% of the audience saying that some things will change. And I think for that change to accelerate and sustain, community participation will be key. So thank you for everyone for the poll engagement, for the audience questions, and for being here with us. I'm going to invite everyone to take a group fee. So you'll probably see this kind of come in through your computer. Just give me 1 second. Close. I just want to make sure, we'll just try to close the poll and then we'll do the group fee. But again, I really want to say to everyone, thanks for joining. Kimbo Care and Pathways to Care, you can actually check out their information online. Kimbo Care's website is there. We'll also put in Pathways to Care information. So I'm going to just invite everyone to take a virtual group fee. So it'll ask you to take a selfie, and then it'll kind of put it all together. So if you want to do that, that will be great. And I'm going to also put Pathways to Care link in the chat, so you can check out the incredible work that Dr. Fatimah Jackson-Best is leading. So I'm going to ask a couple more people to take a group fee. Okay, I see a couple more of you. I'll give you 20 more seconds. Awesome. And yeah, if you haven't yet, be sure to check out Kimbo Care, check out their website, follow on social media, on Twitter, LinkedIn. I know some of you got access to this through LinkedIn. And yeah, that's about it. So you have 10 seconds, and then I'm going to end the group fee. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, so I'm going to end it. But yeah, again, thank you so much to everyone for participating. Kimbo Care is doing incredible work, and it's been really promising to see also, while they're doing this work, this really hard work,